Okay, Bismillahirrahmanirrahim. So this is my boy, okay, 4 years old. His name is Sam. He was admitted with high-grade fever and cough and cold. Okay, fever and cough and cold. Now he is in ER, okay, ER, because he was having some shortness of breath with the cough and cold. Okay, and in the X-ray was done. Actually, GP referred because there was a heart size increased.
This one, GB referred?
Yeah, GP referred to the ER. Okay, you are the senior registrar, pediatric registrar. You came to see the child in the emergency room. Just beside the emergency room, there is a waiting room, right? You are talking with the mother in the waiting room. The child is
This
in
X-ray has showed, yes.
cardiomegaly. Okay, X-ray is there is increased heart shadow, and the child was having fever for 2 days. Suppose 2 days fever, and cough and cold for 5 days. Suppose 5 days, and there is shortness of breath for 1 hour. 1 hour. Okay. The child was emergency department in the ER. Now in the ER. So this is a setting. This is the setting for history taking. Okay. And you are the senior registrar. I am
But
the
this X-ray only showing cardiomegaly.
Yeah, yeah. And the child is actually referred from GP, na? So he is now in the in ER emergency department. You are taking history, then you will shift to ICU or something where you feel right? So take history from the mother. History taking is how many minutes now? 13 minutes or 14 minutes?
As I know, 13 minutes. I'm not sure. I'm not really updated.
Yeah, 13 minutes for face-to-face. No problem. We will practice with 13 minutes. Okay. So,
Okay.
Rihanna, you are free or I will keep the time?
I will keep time until I go. No problem.
Okay. So, yeah, you keep prepare the differential diagnosis. I'm giving you 2 minutes. Just keep prepare the differential diagnosis.
Okay. Just wait, yeah.
So this is 4 years old boy, Sam, coming to ER by GP referral, right?
Yeah,
Fever, cough, and shortness of breath. Chest X-ray shows increased heart shadow. Okay. When you are ready, tell me. I will put the time.
Sorry. Sorry for that.
No, it's okay. You just prepare the DD, then we will start.
Yes. I was talking. I thought it's open.
Okay. You are ready? You are ready?
It's actually mute, I think. I will keep the time.
Yeah, you're ready?
Yes, I'm ready.
Okay.
How many minutes? 10 minutes, huh?
First of all,
13. First,
First
yeah,
of all,
yeah.
10 and 4, I'll think. Huh?
No. Now we are practicing 10 and 4. Okay. 10 and 4. Class.
10 and 4.
Okay. 10 and 4. Okay. Okay, good. Great. Okay. Did you start?
Yeah, start.
Just start now. Good morning.
Good morning, doctor.
I'm Dr. Wiam Ahmed, one of the children doctor in this hospital, and I believe that I'm speaking to Sam's mother.
Yes, doctor, that's me.
Okay, welcome. I have read the referral letter from the doctor that you came from, and I want to take some history for regarding Sam's condition. Is it okay?
Yeah, doctor, sure.
I want you to tell me about the concerns and the complaint, the fever, the cough, when the fever had started for Sam.
Doctor, actually, Sam has got fever for last 2 days, and then he had a little bit low cough in last 5 days. But I think last 2 days the cough is increased, and so we came to GP, and the GP said that your child is having some problem in breathing, and he did an X-ray, and that showed some big heart. So that's why he referred here, doctor. I'm very much worried, doctor. What happened to my child?
Okay, I understand. I will take this history, and then I will tell you about the management plan. Is
Yes,
it okay?
doctor. Yes, doctor, sure.
Okay. So when the fever had started, how much the grade? Is it high fever? How much the fever was?
Doctor, actually, fever was started, I think, by some low fever, like around we measured in the thermometer, and it was around hundreds, and then it went up. It was up to 102 degree.
Mm-hmm.
That's why,
Was it okay?
that's why we went to GP today.
Okay. Was it responding to the medicines that you give to reduce fever, or it's continuous and not responding?
At first day it was going down, but today it was not going down. That's why we rushed.
Mm-hmm. You told me he has a cough together with this fever.
Yes.
Was it there was some sputum coming out with this cough, or it was a dry cough?
No, nothing coming out, doctor. It was almost dry.
Did you notice that it's more at the night time, or day and night? It doesn't differ.
No, doctor, no specific time for that.
Mm-hmm. You notice that he's not breathing well over just the last 1 hour. Did you notice that?
Yes, doctor, I was also noticing some breathing problem, and when I went to GP, he also said yes, he has some breathing problem.
Did you notice that he cannot breathe, or he is hardly breathing while he's lying on his back or sleeping?
Yeah, I was noticing he is breathing very fast.
Okay. Did you notice that he is not his activity is not like before?
Yes, doctor, for last 2 days he was very slow. He was not feeding also not well, and he was not doing well.
Does he have runny nose, or?
Yes, doctor, with the cough there was runny nose at 5 days, from 5 days.
Okay. So do you have any other complaint together with this fever and cough and difficult breathing?
No, Dr. Sam was a good boy, actually. We did not notice any other problem since birth.
Did he have such condition before? I mean, since birth,
Doctor.
did he have?
No, he had cough and fever before, but this time is very serious.
Have he been admitted before to a hospital?
No, doctor, not needed.
So I need to know, is he having any allergy, or any allergy to medicine, or even kind of food, or any allergies?
No, doctor, Sam doesn't have any allergy.
He's okay. I need to know if he has any other concern or something you want to tell me, like chronic illness or any condition that I need to know.
What is mean chronic, doctor?
Like he is having, yeah, this chart. Like having medicine that he's taking for a long time, some condition that he is having, he need to take medicine for long time, more than 3 weeks. I mean, long medicine
No,
that he need to
no,
take.
no. Only when he had fever, sometimes we gave him paracetamol before this condition. No such medicine he was taking.
Mm-hmm. So did you notice that he sometimes having his lips turn blue, or his face color turn blue or
No,
pale?
doctor. No, doctor, there was no such condition.
And you did not notice that he is having swelling at his legs?
No, doctor, no.
Okay. I need to know that is he the only child, or there is other children in the
I have
for you?
another girl, doctor. He is 7 years old. She's 7 years old.
And she is healthy?
Yeah, she's healthy.
Okay, so Sam is 4-year-old. Is he in preschool or going to daycare or?
We are preparing him to give in nursery this year.
Mm-hmm. So I want to go back a little bit, the time he had been born.
Yes.
Could you tell me about his birth?
Doctor, actually, he was born normally. I did not need any cesarean, and his birth condition was okay. And in pregnancy also, I had no complaint except the checkups I did. And Sam is healthy, doctor. Sam is born healthy, and he was, until this condition, he was healthy.
Okay. And did they do any checkup, routine checkup after birth?
Yeah, many times they check up before the vaccination and hearing. They did hearing test. They did everything actually.
And it was okay.
Normal. Yeah.
Okay. So do you think that he is gaining weight similar like his older sister, or he is a little bit behind?
No, I think he's. He's like just like his daughter, just like his sister. He's fine. Doctor.
Okay. You told me that he received all of his vaccines. Is it true?
Yes, doctor. Yeah.
His shots. Yeah.
Yeah, shots are okay.
Yeah. Okay. There is anything that you want to tell me, or if you think it's of concern, or you concerned about, you want to tell me about Sam?
I don't know,
or
doctor.
anything I need to know?
No, there is no such illness before this. That I think this is the most severe condition Sam has.
Okay. I'm sorry for that, and I'm sorry for. I understand your worries, but let me. I want to ask you about a few things that it's routine that we ask about, and it's okay if you don't want to answer this.
Okay.
Are you and Sam's father living together?
Yes, doctor. We live together.
And the home that you are living in, is it rented or your own home?
Yeah, doctor, it is rented. We have 2 bedroom in our apartment. It is
Yes.
quite well, doctor. It's quite well.
And is it well aerated? There is windows and well aerated, yeah?
Yes, doctor. Yeah, no problem. Yeah.
Do you have pets at home?
No, doctor, we don't have pets at home.
Okay. Okay, thank you, Sam's mother.
Yana, how many minutes?
10 minutes.
Okay.
10 minutes. Okay. So now I'll summarize.
Yeah. So you
Okay.
finished within 10 minutes? You don't have anything to ask me?
Before 10 minutes, I think خلاص we finished
14
all.
minutes. You have 14 minutes for history, okay? Or you finished in 10 minutes, okay? Okay, then thank me properly.
Okay.
Thank me properly.
Thank you. Thank you. I don't know the name, so I said Sam's mother.
Yeah,
Thank
yeah.
you very much, Sam's mother.
Yeah,
And
thank
I will
you.
come soon. Yeah, I will come to you soon to assure you about Sam and tell you the more details about him.
Okay.
And I will tell you about the management plan. Okay.
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 Now summarize.
Okay then. Okay. So this is a 4-year-old male came complaining of fever, cough, and cold for 5 days and referred by his GP to the ER after 1 hour history of shortness of breath. On chest X-ray, the child labeled as having cardiomegaly, and there is no significant past history. The patient has not been admitted before. Just wait. Pause for a second.
Okay, okay. Pause the time. Okay.
شغل لك التلفزيون. اقفل الباب وراك.
Shall I restart?
I was talking. I thought I opened the mic. Sorry for that.
Okay.
Okay. And in brief, there is no significant previous history, as the patient had no chronic condition and had no previous medical or hospital admission. The child has no history of having allergy, and from social history and family history, that the child is has no family history of significance.
Okay.
So in conclusion, that my differential could be that the child is having congenital heart disease. Most probably can be an ASD, maybe.
First diagnosis of congenital heart disease.
Congenital heart disease, ASD.
Mother said you there is no condition. Mother said you never admitted. No
never admitted, and the screening was normal, but
yeah.
you know.
Okay.
But
so
you know, for the my first differential is congenital heart disease. The second differential, it can be just a chest infection.
Like chest infection, like
RSV.
Okay, this is pneumonia. You are saying bronchiolitis, right?
Or bronchiolitis, yeah.
Okay, bronchiolitis or pneumonia.
Or pneumonia, yes.
Yes. Any other condition? Very common. This child presented shortness of breath, cardiomegaly.
Cardiomegaly. The child may have myocarditis after viral infection.
Yes.
Viral infection. Yeah.
Yes.
Yeah.
So
myocarditis. Viral infection. Yes. Especially if he is having tachycardia. Yeah.
Yeah. So bronchiolitis, pneumonia. Then we can say congenital heart disease, and we can say myocarditis.
Myocarditis after viral.
We can other diagnosis like pericarditis also will present like shortness of breath. Okay, pericarditis.
Oh, yes.
And we can say dilated cardiomyopathy.
The DCM, but dilated cardiomyopathy, it will be for longer history. It will not be short, like 5 days only. Yeah. Yes.
Okay, so you can tell like this when you present to the examiner. You can say like this, that with the above history, my first differential diagnosis is pneumonia with heart failure because there is shortness of. My second differential diagnosis is bronchiolitis with heart failure. My third differential diagnosis is viral myocarditis or pericarditis. Okay. And my another diagnosis, it can be dilated cardiomyopathy, but in this case, the history will be recurrent.
It will be yeah.
And congenital heart disease with heart failure, but that also will be previous history and recurrence history. So on top of these diagnoses, pneumonia, bronchiolitis, myocarditis, pericarditis, these are the main differential diagnoses for
Yes,
this
that's
child,
true.
right? So
Yes.
if it is myocarditis, then what is the cause of myocarditis?
Viral myocarditis, I mean viral infection that cause myocarditis.
What type of virus?
Mainly enterococcus, right?
Virus, coccidioides.
Coccidioides.
Which one? Coxsackie A or
Coccidioides.
Coxsackie B?
No,
A16.
I think I'm not sure.
Coxsackie B. Coxsackie A causes hand foot
Yeah,
mouth.
A.
Yes. One of them is hand foot mouth syndrome.
Yeah,
Yes.
that is Coxsackie A. And
Coxsackie
this one, viral myocarditis.
But we have seen cases post RSV.
Yeah, also post RSV, respiratory syncytial virus, adenovirus, and enterovirus. Okay.
Yeah,
Also,
enterovirus.
also it can cause by human, that is HSV, herpes simplex virus, Epstein-Barr virus. Okay, it can also cause
EBV, yes, and EBV also will give you the cardiac the picture of widened mediastinum because of the lymph nodes.
Okay, lymph node, yes, lymph node. So it will be wide mediastinum because there is a features of
They'll call
mediastinum.
lymphadenopathy. They'll cause
Yes.
lymphadenopathy.
Yes.
Yeah.
So this, for this child who is in ER, what investigation you will do?
Okay. Investigation. First of all, I will start with the pulse oximeter and then I will take I will do CBC to see hemoglobin, white blood count, and platelet count to tell me about the hemoglobin. Maybe it's worsening the heart failure. The white disease will give me if he is having infection, platelet count as well. I will do the routine labs like renal function test to see electrolytes and urea and creatinine. I will do I will, for this certain case, I will do echo because he is having cardiomegaly. So in the echo, I will look for the heart function. I will look for the the specific lesions. If he's having any lesion, I will look for the pericardium. If I'm having pericarditis, maybe he will have effusion, pericardial effusion.
Yes.
Yeah.
So if you do ECG, what finding you will find? I mean, you suspect what finding in this child, ECG?
In ECG, I can find like short voltage ECG or like low amplitude ECG.
Yes. For what? Which condition? Low amplitude for which condition?
Like pericarditis, pericardial effusion.
Very good. Yes. Yes.
Effusion and pericarditis, both you will get this, no?
Yeah, you will get low voltage. Yes. And then any other ECG abnormality?
Maybe I will have a bundle branch block or AB block, any kind of block if I have DCM or myocarditis.
Myocarditis will be block. How?
For this, if it became dilated, I will have
block. Okay.
And
so,
if I have DCM, I will have like if I have tricuspid regurg, I will have P pulmonale.
Okay, I got it. I got your point. P pulmonale. Okay. So, what is your management plan for this child?
Okay. Oh yes, for this child, first of all, I will provide oxygen.
Okay.
Then I will I will
ABC, right?
Yes, ABC.
Yeah.
Oxygen, and then I will put on comfortable position, 45 degree.
Okay.
And I will start with the after taking the blood samples, I can start with the IV maintenance fluid, or half maintenance, and
Okay.
I can start with the empirical and antibiotic treatment till we prove that he is having just viral infection. And we can give nebulization if he is in need, or like mucolytics.
Okay. Okay.
And if for the fever, we'll give oral paracetamol or rectal, or even IV if we need it.
Okay. If suppose this child has heart failure, then what is the
If the child
management?
is heart failure, for management of the heart failure, I will give diuresis. I will give furosemide to diurese, and also I will give AC inhibitor like captopril.
Okay. Okay.
And if yeah.
So according to the prognosis of myocarditis, what is the prognosis of myocarditis? Any more specific medicine you want to give for myocarditis, viral myocarditis?
Yes, for myocarditis, we give non-steroidal anti-inflammatories.
NSAID. Then?
Yeah. Then we'll do serial checkup.
Is there any role of IVIG?
IV immunoglobulins. Actually, in our center, I didn't find that they are giving, but maybe, I don't know.
Okay, suppose you are giving treatment on the ventilator, but the patient is not improving in extreme cases. What is your last option in management plan?
Yes, I will give IVIGs and will give steroids as well.
Okay. Is there any role of Ecmo in this patient?
Yes, if the child is in need for Ecmo, or the heart function has become severely depressed, and the child maybe he will be a candidate for an Ecmo.
Okay. So what is the prognosis of myocarditis?
For viral myocarditis, the prognosis is not bad. It's the outcome usually is okay. The child may improve after may resolve after a few months after the illness. Given in the picture that the child will have will go home even with the diuretics and will come to the follow-ups.
Is there any mortality or any permanent damage of the heart?
I don't know a percentage for a mortality, but yes, there is a mortality rate.
And any permanent
it may affect. It may become permanent. It may become permanent.
Okay, and then what is that called? If it become permanent?
If it became permanent, then it will call dilated cardiomyopathy.
Yes, very good, very good.
Dilated cardiomyopathy, and that
Yeah.
has different kind of management and things. At that point, maybe if the child had dilated cardiomyopathy, it means he will need a heart transplant, because at this point it's irreversible. It cannot come back like before. If the function is severely depressed, also the patient will need anticoagulation together with the medicines, because the function is poor and the heart is large. So the blood will be pooled, or still stages of blood in the ventricles may make it forms thrombus in the ventricles.
You will not tell these things to the examiner, right? You will not tell this.
No, just stop between me and you.
Okay. Now, now let me tell you the problems of history taking. Okay, first of all, your history taking was very good, but remember, when you have finished time before 14 minutes, that is in the 10 minutes you finished the history, that means you missed a lot of history. Because in 4 minutes, you could ask me 10 questions more 8 to 10 questions.
I even remember, but I intentionally didn't ask you the specific CNS, renal, and systemic review. I didn't ask you because I asked you just like in general.
Okay.
And apparently, what has appeared to me from the history that he is just have a recent concern for this. And previously he didn't suffer any.
But if you asked me, I would tell you. Okay, if you ask me, then I would tell you many things. Like you asked me one important question, that blue is the child anytime became blue. Okay.
Yes.
So see, this mother said many time we came for scanning and some. So this child could have been ASD or something. You said in the differential it can be ASD with heart failure.
I said,
I'm telling you that from the beginning, when you said when the mother was anxious, okay, did you ask me about attendance? No, you did not ask me.
But here we don't need attendance for the history taking, right?
I don't know.
I don't know, but as I know that we don't need attendance for history taking. But because you will not support, you will not say, okay, she will not need support. She will give me some informations only here. This is what I know. I'm not sure. But as I know, in the communication, we need somebody to attend. Maybe she will need support, somebody to be with her, like, but I don't know.
Another is, I will write some points. Okay, if you have, I mean, I will write some points. Is that okay with you? Mother will say, okay, because you have to write these things in front of the mother. Sometimes mother feels offended that, so you have to take permission that I'm going to write something. Okay, is that okay with you? Okay. Now, first of all, for the fever, you asked me only 2 questions, but you know, fever history has 10 questions.
But I was afraid I will skip.
You skip any fever related question. Okay, like first of all, your mistake was you asked me close question, like how many fever, what is the temperature, how many. You started with closed question. But
or just describe the fever for me.
Should be right. Describe the fever for me. So I was waiting for that question, but you started with how many fever he has, what is the temperature. You started with closed question. You did not ask me open-ended question. That if you said me that can you describe the fever for me, then I have many other things like, yes, Dr. Fever was started from today. Initially it was low, then it became high. I measured with the thermometer, and it was, first of all it was 100, then it was 102, then I gave him paracetamol, but it was not. So in one line, I would give you many. Okay, you did not ask me the open-ended question. This is very, very grave mistake, you know. Second time, after mother finished the history of fever, you then ask the close question like, was the fever continuous or it was coming down and then again up, like intermittent? So the mother was saying, no, doctor, it was, first of all, it was coming up and down, but for one day, it is now not going down, it is continuous. Then association of the fever. Okay, you did not ask me. Association of the fever. Was there any skin rash?
Chills,
Because it can be rheumatic heart failure. You know, rheumatic. You did not ask about joint pain. Was there any joint pain? Was there
I skipped all the systemic review. I remember it's intentional. I didn't forget it because I thought it's because from what I knew that is just there is nothing else together with this. I asked, there is anything associated with fever only, and you said this. So I thought maybe I will waste a lot of time if I ask.
No. Yeah, you
But
cannot
I
be
supposed to ask.
sure. You cannot be so sure. This patient may have joint pain from the last few days. Mother did not tell you, right? It was fleeting in
Yes,
nature.
reactive arthritis also common with the with the viral infection. Yeah.
So the joint pain and rash, very important for rheumatic fever. This child can have rheumatic fever with heart failure. Rheumatic fever with heart failure, very common condition, especially in these Asian and these countries. Okay, so rheumatic fever. You did not ask about joint pain, skin condition. Regarding the breathlessness, shortness of breath, you asked only 2 questions, like you noticed, right? You said me like that. You noticed, right? There is breathing problem. No, we cannot ask like this. We have to ask, tell me about the breathing problem. Open-ended question. Tell me about the breathing problem. Then the mother said, yes, doctor, I was noticing for 2 days that he's not breathing properly. Sometimes he's breathing fast, sometimes he's breathing slow. And then he was not eating with this breathing problem. That's why I went to GP. So, like, please, can you describe the breathing for me? These two should be open-ended question. And then you should ask about, first of all, start with the respiratory, like, was there any feeding problem? Yes, he could not feed properly because of this breathing, because he's developing heart failure slowly. Okay, was there any blue color? You said this, you asked this. Yeah, no, doctor, there was no blue color. Does he have any heart condition before? No, doctor, he did. That means ASD rule out. Okay, no, doctor, he did not do. Okay, then was there any specific time for this breathing pattern, like at night or at morning, early morning? Why at night? Because during sleeping time?
Orthopnea, I asked for, when he lie down,
yeah. So did you feel any coldness in the periphery? I mean, in the fingers and in the toes? Did you feel any coldness? That means shock. The child was in shock or not? You did not ask about shock. Okay. Now come to the most important point, that is cough. You did not ask anything about. You asked only one question, that was it productive or not. You did not ask anything. Cough, there are many questions, like, was the cough particular? Tell me about the cough. First of all, open-ended question. Then the mother said, doctor, cough was, I think, dry type. He was coughing all day, doctor.
All day, yeah.
All day. And I heard there was some runny nose, doctor. So she gave me a lot of information with one question. Tell me about that. Then you say that, was there any musical sound, or is this type of cough he had before that you relieved by some nebulization, some gas? That means bronchial asthma. You are excluding bronchial asthma. This child can have bronchial asthma with exacerbation. We don't know. With heart failure.
But there is no, before he hadn't a similar condition at all, and had no hospital admission. But I suppose, you are true. I have to ask specifically.
Yeah, musical sound and cough is at night. That is the diagnosis for asthma. Then you should analyze about the heart failure, some question that you can do with the shortness of breath, like he has sleeping problem last few days, he cannot sleep at night, orthopnea. Okay.
Then, or even the same question of is he feeling breathless while lying lying flat? Reduced and the other question I asked for exercise interns.
Yes, reduced activity. You asked. Yeah, you asked that activity is reduced or not. But these 4 questions, like cough, fever, and shortness of breath plus heart failure, these 3 should be asked open-ended question. There are 3 complaints in this: fever, cough, and shortness of breath. So you have to ask 3 open-ended questions. And you should take some time for this present illness. This will differentiate you from congenital heart disease, bronchial asthma. You will rule out. Okay. Then you go with the systemic inquiry. Was there any fits before? Start from CNS. No. Was there any awareness of heartbeat before? The child was telling you, mom, my heart is racing. That is congenital heart disease with tachycardia, tachypnea, or
this should be even with the history of presenting illness.
How come? In dilated cardiomyopathy, the child will tell the mother repeatedly that, mom, my heart is racing, my heart is racing, I feel racing. That is, the child has repeated history of tachycardia.
Arrhythmia maybe as well.
Arrhythmia, long QT. You did not ask about any family member affected or not. Very important. How come is autosomal dominant?
Just the sister only,
long QT is autosomal dominant. Family history of any SIP death, very important for long QT and how come. Okay, you did not ask. Then you did not ask about the GIT, failure to thrive. What was the growth of the child?
And no, the growth
GIT,
I asked about, and she told that the
normal.
growth
Yeah,
is similar
normal.
to the
Yeah.
yeah, normal, similar like.
You did not ask about the GIT, tummy. Was there any problem in tummy? Was there any problem concerning hearing and vision? Very important, hearing. How you know this child has no problem in hearing and vision? Maybe the child is deaf. The mother is visiting outpatient department. He did not admit it, but he can. So you have to ask about, is there any problem in vision and hearing? No, doctor. Okay. Is there any problem in pee and poo? No, doctor. Any tummy ache? No, doctor. One question, just few seconds. It will take few seconds. What is the color of pee? Did you notice any abnormality in the pee? No, doctor. Okay, shish. Then regarding past history, can you tell me, mom, was there any condition before that you required repeated visit to the hospital or GP? No, doctor. No, doctor. So no history of. Was there any surgery before? Surgery like circumcision, like.
But if no visit to the hospital, it means by default there is no surgery history.
Yeah,
I was
yeah.
about to ask that, then I found that it's foolish to ask about.
Yeah, finished. Yeah, you're right. But you cut it very short, you did not ask about many systemic inquiry. And perinatal you asked. Yeah, mother told you. See, in the perinatal history, you very nicely you said that, can you describe the birth? That is the good question. Yeah, mother described you, there was no problem in the pregnancy, it was term baby, it was normal delivery, and we discharged after home. Mother described you also, you no need to ask any more question. Then immunization, you said me, what you said, I'm telling you. You said me
The what?
that you said me that you give all the shots, right? No, wrong. You will not tell me like this. You will tell me, mom, did Sam got all the vaccination? Yes. Any special vaccine? No, doctor.
Okay.
Okay, you did not ask me any special shots, any special jab. You did not ask, because this child may have got some, pneumococcal or some, maybe, yeah, we don't know, right? Drug history you asked, yeah, drug history you asked, allergy history also you asked, I remember. And development history, you said two questions in one question, like, was the growth normal? But development is other than growth. Like, can you describe me his growing pattern? I mean, he's growing normally with like his sister, or is growing slow? Okay, no, growing normally. Okay. Was there any concern for his growth or development? No, doctor. Okay, class, finish. Then you can say, tell me anything, tell me about his feeding. Oh, doctor, he took family food with us. And you asked me about allergy, that is okay. Family history, you did not ask. Now, this is the past history. Okay, family history, past history. Now, where did you did a lot of mistake? That is the social history. In the social column, you did not ask many points. You asked, yes, about the school, I remember. You asked the parents living together or not. You did not ask me about the financial condition.
Yes, I remember that.
Yeah, you did not ask me, because this child may need
If you
support.
are working or not. Yeah.
Yeah, you are working. Who is taking care when you are going to work? Maybe this is a case of non-accidental injury. You don't know. This is shortness of breath for what? For viral infection or for some trauma in the chest? You don't know. You don't know anything, right? So you should tell, do you work? Who take care when you go for work? You did not ask, okay? And is the income satisfy your family? Is the income
Fine, yeah. I
enough
forgot
for
about
you?
the financial aspect.
Yeah. And you did not, you asked about the family. You did not ask about the smoking, alcohol consumption. Does anyone take alcohol at home? Was there any smoking? But smoking, alcohol, this smoking, important for respiratory
It's
problem.
supposed to be in if the case is chest, or I'm suspecting atopy, asthma, or smoking.
Yeah, even pneumonia aggravate by smoking. Okay. Ventilation you asked, air, pets you asked. Now you said me 3 times that, is there anything I missed that you want to tell me?
Because because this is what I remember, that we have to ask like this, because
But
maybe there is something that we didn't cover, and
yeah,
Yeah,
But
they
three times, not 3 times. Yeah, only 1 time. That is at the last. At the last.
Okay.
In the social history, you will ask that, Mom, we have take a lot of history today for Sam. Now, regarding Sam's current situation, do you think that we did not talk some important thing, or we did miss some point? Can you remember some point that is important for Sam? No, doctor, because this is the acute condition, so nothing. Okay. So, okay. So last of all, thank you. Okay, for
Thank
giving your
you. Yeah,
time.
these are
Yeah.
great points actually. Yeah, I
Yeah.
missed. Yeah.
And I will come back to you once once I have more question. I will come back to you, because sometimes you can have more question to ask the
Yes,
mother, right?
that's true. Yeah, yeah.
So you missed many important points, especially the
Yeah.
inquiry and the asking question. You will not like this, right? You said me that, right? No, this is called, no, this is called what? This is called, you are guiding the mother. I mean,
Guidance question.
yeah, you cannot guide the mother. You say, you ask the mother that, can you tell me about development? Can you tell me about immunization? Or what was the
But you know,
immunization?
the open questions will consume time. It's
Yeah,
supposed
but
to be
first
not
few
all of them.
questions, yeah, first few questions should be open. And then, okay, all the jabs are given. Yes. Okay. Is there any family member affected? No, doctor. Okay, this is closed question. But first few questions should be open, and birth
Yeah.
history should be open.
Okay, so can we do it again after we finish the one that we will do? I mean, the one for you. Can we do
No,
that?
don't need, no need. You can do this now. Now also, if you want to do, I can do it for you again.
Okay, okay. Thank you.
Okay, I'll keep the time for you. 30 minutes.
Okay.
Just let me give some.
Okay, we'll start.
Wait. Let me keep the timer for you. Stopwatch. Yes, start.
Okay. Good morning.
Good morning, doctor.
I'm Dr. Wiam Ahmed, one of the children hospital in this hospital, and I believe I'm talking to Sam's mother. Is it
Yes,
right?
me. Yeah, my name is Tamanna.
Hi, hello, Tamanna. Welcome.
Okay, doctor. Thank you. I'm not so feeling good, doctor. Yeah.
Thank you. So I'm here to take some history regarding Sam's condition, and I already read the referral letter from the GB. Is it okay with you to start?
Yeah, doctor. Yeah, sure.
Okay. So could you tell me and describe for me the fever that Sam developed?
Yes, doctor. He developed fever for last couple of days, but last 2 days it was very high, and it was not going down. That's why we came to GP.
Okay. Could you describe this fever?
Doctor, I can remember that first of all, fever was, I think I measured that with thermometer we have, and first of all it was 100 around that, and after that time we started giving him paracetamol and it was reducing. But last 2 days, even if I am giving paracetamol, it was not reducing. But there was no other like shivering or something. There was no complaint like that.
Okay. Okay. Did you notice that while he's having fever, he's having rash?
No,
Did you
doctor,
notice?
not having rash. No.
Does he complain of joint pain
No,
or
doctor.
any body pain while fever?
No. He was weak past 2 days, but no joint pain, doctor.
ألين عليك الله امشي عليك الله بجيك بعد شوية.
Yeah, open mic. Yeah.
Okay. Yes.
Yeah.
So he is having cough.
Yes, doctor. He coughed for last, I think 5 or 6 days.
Could you describe more this cough?
So cough is, I never saw him any coming out, but he was coughing all day, doctor, all day, and sometime in night. He was waking up for last 1 or 2 days. He could not sleep properly due to this cough.
Okay. Did you notice that he is coughing more while he's or hardly breathing while he's sleeping or during daytime?
No, doctor. In daytime it was more. At night time, it was not so much.
Could you describe for me the hard breathing?
Oh, he was having some breathing problem for last 2 days. And when we went to GP and GP said his heart is big. So I was very much afraid, doctor, why his heart is big. That's why we rushed to the emergency department. He could not eating properly. He was not eating properly for last 2 days because of this breathing problem.
Okay. Did you notice that he is like not moving or active same like before?
Yes, yes, doctor. He is not doing so much play for last 2 days.
Is that because he is? Do you think that because he doesn't have energy, or because he is gets tired and having hard breathing after a short walk or short exercise?
I think, doctor, he was very active before. So I think this is because of this condition. He's not active properly.
Okay, so this hard breathing, is it associated with his nose was runny and sneezing?
Yeah, doctor, he had some runny nose for last 5 days.
Could you tell me if he was breathing funny, or you can hear some sounds while he's breathing?
No, I did not hear some sound.
Okay. Did you notice that any change in color in his lips? Is it turning blue or
No,
is
doctor,
it?
no, never I noticed blueness.
Okay. Just I need to know that if he is having any hearing or seeing problem.
No, doctor, no. Sam is okay.
Or does he have any like long-standing condition that needs to be followed by a doctor?
No such thing, doctor. Previously, 2 or 3 times we went to GP only for this fever, sometimes cough. He fell down one time. That time we went to GP and GP said it's okay.
Okay. Does he having any joint pain or muscle or any body ache or body pain?
He was very weak, doctor, for last couple of days. I think also he has some pain, yeah, but not in the joints, but he has pain in the whole body for some days.
How is you told me that he is not feeling nicely for the few days.
Yeah.
How is his pee and poo?
Pee and poo is okay, doctor, but as he was not eating, so pee is actually reduced in amount.
Okay. Okay. Did you notice any change in the pee color or the amount?
No, doctor, no.
Have he been admitted previously in a hospital, or does he taking any medicines for long time?
No, doctor, no such thing. He was just a normal child.
So could you tell me about his birth?
He was normally delivered, doctor, in hospital, and during my pregnancy period was okay, fine. I took medicine only, like vitamins and minerals. And after 2 days, the gynecologist discharged us. for Sam, and we never. I mean, Sam was healthy, so we never admit him for any condition.
Mhm. Okay. Does he have any allergy or from medicine or food or any kind of allergy?
No, no.
Okay. I need to know if he is his growth or he is growing same like other children at
Yeah,
his
doctor,
age.
I have one daughter, and Sam is
Mm.
just like my daughter, is growing normally.
Is he? I mean, his development is same like his daughter, his sister.
Yeah, yeah.
I mean,
Same.
like walking and talking.
Yeah, doctor, it was, I think it was normal because I have another daughter, so I can compare. Yeah, it was normal.
Okay. Okay. So you have one daughter. Does she have a similar condition like Sam?
No, no, no such condition in my family, doctor.
She is healthy. Is she healthy? The older
Yeah,
daughter.
yes, yes.
Mm. Um, so I will ask you like some questions. It's a private information. If you want to share me, I need to know. And you are free if you don't want to inform.
Okay, okay, doctor, no problem. Ask
Okay.
me.
So you and your husband, are you living together?
Yes, doctor, we are living as a family. Yeah.
And the house that you are living, is it rented or your own home?
Yeah, it is rented, doctor. 2 bedroom we have. It is rented.
Mm. What is your job and your husband's?
I don't do job because I actually like to work at home, and my husband is a businessman. He do some local business, and we are fine, doctor. We don't have any problem.
Mm. Um, so do you find it difficult, or I mean, is the income from your husband is enough for satisfying for you and your family?
Yeah, yeah, that's enough. Yeah.
Just wait. I will just few seconds. I will come to my daughter. I'm sorry.
No problem. 10 minutes, huh? Yum, 10 minutes gone.
Okay. Did you pause for me, or the time
No,
was
no,
running?
no, no. I closed. I closed.
Okay. Okay. Okay then.
Start. Start.
Okay. Is it enough or satisfactory for you and your family, this income?
Yeah, we are okay, doctor. We are fine.
Um, uh, is Sam in preschool or going to KG?
Yeah, we are planning for nursery school this year.
Okay, great. I just will ask you if you or your husband are smoking or drinking. You can't tell me.
No, doctor, we don't smoke. And my husband is social drinker, but we don't smoke.
Okay. Any pets at home? Do you have any pets?
No, doctor, we don't have pets.
Is it easy for you to come to the hospital, come and go? Do you have a car? Or
No,
how
doctor,
you
that is
travel?
a big trouble because we live in a far away from the city. So today was a very much problem from GP to come here. It is a far and we don't have a car yet.
Okay, okay, I get it. Okay, Tamanna, if there is anything that you, I mean, if anything that I need to know, you can tell me. Anything that I didn't cover.
No, doctor, I just worried about my son Sam. Let me know what happened to him.
get your concerns. I will come back to you soon if I have other questions, and I will come to assure you and to tell you the management plan of SAM.
Yeah, sure, doctor.
Thank you, Tamanna.
Okay. Now it was okay. Now it was quite fine.
But the time was okay because I
Yeah,
thought
the
I
time
will
was
consume.
okay. 12
The
minutes,
time was
30
okay.
seconds. 30 seconds.
Alhamdulillah. Okay. Okay.
And one more thing, yeah, in the history taking also, we have to show sympathy.
Yeah. Yes.
Like when the mother was asking you that I'm very much worried for my son, what happened, doctor, to my son, at that time also, yeah, we have to show sympathy for them. Like
Yes, that's true. Yeah.
well, we have to say the mother.
I thought it's open. I was talking. Yeah. It's true.
No problem. So that time you have to say that I'm really sorry you are going through some
Yeah.
difficult time. I can understand. See, sympathy is everywhere. Sympathy is everywhere. Okay, empathy too.
That's true.
Okay, any more
Okay,
points?
thank you for this. Yeah, thank
No,
you
you
for that. I
point?
will do my scenario.
No, I'm telling you, did you miss any point? You remember any point you missed?
Okay, let me remember. I don't know. You can't tell me, but I will remember together. I don't know.
No, this time history was quite okay. This time you asked me about the heart failure, but you did not, again, you did not ask me about the fainting, any problem,
Heart racing, yeah.
yeah, racing heartbeats. I think it's okay. We will miss some points, I think, because nobody can remember 100%. It's
All
not
of
possible.
it, yeah.
But this time, history was okay. Just change the pattern of the history, like
Close questions to be open questions, same like
yeah.
this
So,
one.
is that so? Like you are asking, is that this? Is that that? Is that that? Like this. Just ask direct. What is that?
Okay.
Okay. What about vaccine? What about the jabs? What about the shots? Okay. Tell me about the growth. Was there any concern about the growth? Tell me. Then what about? What is that? Just ask direct question. It is easy.
Okay.
And it was fine. Let us today let us take break because now it's too late for us.
Okay.